Hi guys, today I'm going to talk about the anatomy of the anal canal. As you can see, I draw here an anus, and I'm going to start talking about where it is start. Okay, it's started. If you see, this is the anus. I'm going to now draw the coccyx. I'm not good at drawing, but it could help. So it is a start 1 inch below and front coccyx as continuation for rectum. So guys, if you see, this is the coccyx, okay, and here is the white things that I draw here is the rectum, and then the red one is the anal. So it's a continuation for the rectum. And 1 inch we said below and front of coccyx. This is where the start of the anal canal. Then second thing, I'm going to talk about the end, where it's end. It's end in anal orifice, as you can see here. The length of the anal canal is 4 centimeters, or they said 1 inch and half. This is all the things that will help you to understand the anal canal. Then we will talk about something more important, which is the relation of anal canal. Okay, now if you could say that we had anterior relation and we had posterior one, and last thing we will have 2 lateral side. So 3 relations for the anal canal. Okay. Now let me draw to you the pelvic. As I said before, I'm not good at drawing, but just something to make you understand what's going on there. So guys, here's the pelvis, and here's the coccyx also. I'm gonna draw in the middle here the anal canal. Okay, here's it. This is the anal canal. Alright. So now let me start. We had posteriorly, or from the posterior relation, something called anococcygeal body. So the anococcygeal body is the posterior relation, while the lateral relation, it will be ischiorectal fossa. So from 2 sides here, okay, this is, I'm gonna draw it, okay, here and there, we had fossa. This fossa called ischiorectal fossa. And last thing is anteriorly we had a perineal ring, or sorry, perineal body. Okay, here we are, perineal body. Okay, so this is the relation. Fifth thing, it's the sphincters. Sphincter is so important structure in the anal canal, because any problem with it maybe will lead to incontinence, especially during the surgery, when you do a surgery for hemorrhoids or even anal fissure, if there is an abscess. So you have to be careful during the surgical intervention about the sphincter. And now especially I'm gonna talk about each one of them. We have first one, as you see here, the internal sphincter, and above it there is an external sphincter. Here's the line that I draw in the middle. This is called pectinate line or even dentate line. So now let me put a differentiation between external sphincter, internal sphincter, and there is something called anorectal ring. Anorectal ring you will understand it when I will explain in the next videos about the fistula, how this ring is gonna help you. So let me start with internal sphincter. Okay, internal sphincter, it's form of muscle. This muscle, it will be circular muscle, and it is a continuation for the rectum. So you can see. Okay, while external is form of straight muscle. Now here we are, the anorectal ring. Anorectal ring, actually it is it's just junction between the rectum and the anal. So this, if you see, I draw here this pink line. This line is anal rectal ring. It's the junction between the rectal and the anal canal. It's actually fusion of four muscles. First one is called pupae rectalis muscle. It's part of levator ani. And the second thing is the deep layer of external anal sphincter. Okay, as you hear, okay, external anal sphincter. Then we have internal anal sphincter itself. This is the form part, the muscular part. And the last one is the longitudinal muscle. Okay, it is maybe if you cut this ligament or this ring during the surgery, maybe incontinence for stool gonna happen. And when you do a PR examination, you will find as a ridge. You will find anal rectal ridge. So second thing, the internal sphincter is surrounding upper 3/4 of anal canal, while the external sphincter is cover the whole anal canal. The internal sphincter, there is no continence gonna happen if you cut it, while external sphincter, the continence is gonna happen. There is incontinence. Also, there is incontinence in anal rectal ring, as I mentioned before. The nerve supply, the innervation of the internal sphincter is autonomic. It is involuntary, while the external, it is inferior rectal nerve. Maybe it's S4 and it is somatic. Good. Okay, the last thing we gonna talk about is the cavity. Here we are, the paper is gonna end, and this is the last topic in this video. So we have the cavity. The cavity, as you see here, is the anal. Okay, and this is dentate line, or it's called pectinate line. The part above it, it's called upper cavity, and the part below it, it's called the lower cavity. Okay, now about differentiation between them, we have upper and we have lower. I'm sorry, just made a mistake, so I tried to put the upper in the second table and the lower in the first table. Just try to convert them. Sorry for this mistake. Okay, now let me talk about the lower. Okay, the lower half, it is supplied by middle and inferior anal artery, while inferior artery, while the other one is by superior anal artery. Then the vein, middle and inferior anal vein, here the superior anal vein. Then we will talk about the nerve. So in the lower we have inferior rectal nerve, and here we have autonomic nerve supply. Last thing is the lymph nodes. Lymph nodes for the lower is gonna be a superficial inguinal lymph node, while for the other one is the internal iliac lymph node. Okay, iliac lymph node. Good. This is gonna help you guys to understand the next topic that I'm gonna talk about, such as we will talk about hemorrhoids, or even maybe we will talk about the fistulas, or even the abscesses of the anal canal itself. Here we are, hemorrhoids, fistula, and abscess, fissure even, or abscess. So see you in the next video, and wish you good luck in your examinations. Bye bye.